Good evening, everybody. It's a pleasure to meet you all once again. Now, we are going to start a series of short videos wherein I'm just going to touch upon only one topic, unlike the other long ones which are going to be in detail. So, one of the things which I'm going to start off today is going to be ear piercing. Now, why did I take this topic? Of late, I am finding a lot of people getting their ear pierced and suffering from complications. What complications there are going to be in a ear piercing? There are so many things that can happen. One of the main things which can happen is the ears getting pierced on the sides or on top. What people don't realize is the ear is full of cartilage. You can just touch it, you can feel, you can see a firm structure which is moving. That is known as a cartilage. That's extremely sensitive and extremely non-forgiving. What do you mean by non-forgiving? If there is going to be an injury, there is going to be lots of complications. So that's why they put here. If you see, it's very soft. There is nothing over here, no cartilage, nothing. There won't be any bleeding also. So majority of them they pierce the ears only over here. But now, for cosmetic reasons and for so many reasons, people get pierced here and they come back with problems. Even over here, I've seen a lot of people having issues. So what are the issues that can happen because of an ear piercing? One, if it's not done in a sterile way, it can lead to an infection and the ear stud needs to be removed. Here is a picture of a patient who had an ear infection. Two, what will happen is if you are going to pierce here, it can lead to a serious condition known as perichondritis. Okay, what is perichondritis? Perichondrium is a layer which is covering the cartilage. So it's like your skin which covers your muscle and bone. So that tissue, it gets irritated, inflamed, and the cartilage also gets affected, and the entire shape of the ear goes away. Okay, you can see in this patient didn't have ear piercing, but he had used a earbud, but the same thing which can happen after ear piercing. Okay, you saw how bad it is. Now, three, another thing which can happen is something known as a keloid. What is a keloid? It is a reaction of the body when not done in a sterile way, leading to, what we call as hypertrophy of the skin. And it's an ugly thing. And even if you do surgery, it's going to keep recurring. Even if you give injections, it's going to keep recurring. So, if you want to get a ears, go to a specialist doctor or go to a center who does it in a sterile way. Like in our clinic, we use gunshot and we use imported studs which are all sterile, 100% guaranteed sterile, where we take it only in front of the patient and there's no touching of the stud. What do you mean by a sterile? When you touch, the sterility goes away. So if you look at in most of the jewelry shop, what they do, they take it in hands. So sterility is gone. But in the clinic, it's all 100% sterile, where it's all loaded directly into the gun, and we do not touch it because the one which goes into the ears needs to be sterile. So I hope you find this video useful. So before you do ear piercing in any other way or in any other place, just look at these pictures, remember these pictures, and safeguard your ears. Thank you.